I've been involved with teaching doctors for the past 10 years. During that time, I have spent working with doctors on improving their communication skills as well as interview skills. While there are many tips out there for interviews, I have come up with some that are applicable for doctors. This is all based from experience. Many doctors ask me for tips or suggestions for their interviews, how to be better in their interviews and what they can do to improve. Out of all of them, I would say confidence is the most important. In addition, there are 6 other points to consider. Let's take a look. Thank you for checking out this channel. My name is Mark. Number 1, confidence. Confidence goes a long way in interviews. It definitely applies to residency or a fellowship position. What is confidence? Confidence is believing in oneself. Simply a feeling of self-assurance in one's abilities and skills. Confidence should not be confused with arrogance. Arrogance is often showing that you feel superior to someone else based on your skills. Confident people can listen and learn. Arrogant people often do not listen. Why is confidence important? Confidence is key because you can highlight your strengths as a doctor. This is because you know you have these skills that you can make a difference. In order to think about your skills, you need to consider a couple of questions. What are your skills? How confident are you? When it comes to interviewing, it is important to be clear about your skills and abilities. Do not be shy about talking about them. Make sure you provide examples of your abilities and skills. Number 2, research the programs. This is something that absolutely needs to be done. If you're applying for a program and you have no idea what that program is about, who works there, why they are famous, any important publications or any important news, then chances are that is going to be evident in your answers and in your approach to the interview. If you want to be in the top position as a candidate, you do need to know as much as possible about the program. Some questions for you to think about and to do research. What is a program or hospital famous for? What kind of research are they involved in? What publications have they been published? Do they have any awards for anything? More importantly, is there any specific doctor or doctors that you want to work with? Number 3, be prepared. It's important to prepare for your interview. Interviewing for residency is a very life-changing experience for you. The result of your interview will determine perhaps the course of your medical career. You need to be familiar with all types of questions. You need to be familiar with routine questions. You need to be able to anticipate what they're going to ask. You should also review who you are meeting with. Each team member will have his or her own idea about what it means to be a good resident in their program, and they will ask questions accordingly. Some common questions that come up: what made you go into medicine? Where do you see yourself in 5 years? How do you handle criticism? Point number 4, listen. Listening is often overlooked in interviews. It is very important to listen carefully. There are always variations to questions. These variations require you to change your answer a little bit. Listening is important because you can avoid repeating yourself. You can avoid going off topic. You can avoid answering the wrong way. Listening allows you to get a feeling of the interviewer and get a feeling of the position. Number 5, let the interviewer lead. While you are tempted to start speaking, it is a good idea to let the interviewer lead the discussion. The interviewer may be busy. He or she may be meeting with around 15 to 20 candidates in one day or over the course of several days, in addition to the other work that they need to do. It's important to answer the question as asked. You can elaborate, but try not to talk too much. Pay attention to the interviewer's body language and facial expressions. That will give you a clue as to if they're listening carefully, or if they're struggling to understand you, or if slightly not impressed by your answer. Number 6, relate your experience. It's important to relate your experience to the position. Know your experience and be good telling about it. You might be applying for a certain residency or fellowship position. You want to highlight your strengths in that position. You have to highlight what you have done and what you are comfortable doing. If you don't have any experience, for example, if you are a med school student or you are a PGY 3 or 4 doctor and you've decided to pursue another pathway, example, switching from gastroenterology into general internal medicine, you need to use your valuable experience from gastrointestinal medicine and see how you can apply it for general internal medicine. What did you learn from that? Point number 7, make a list of questions to ask. At some point, the interviewer hopefully will ask you if you have any questions. This is a perfect opportunity to get answers. But you need to think of the question first. You need to think about what you want to know about the program. What are your concerns about the program? You can ask about research opportunities, the number of cases or patients that are often seen. You can ask about mentoring programs. Now, what if English is not my native language? Given that your interview will be in English, it's not a good idea to say that you're not comfortable working in English or that you feel that you struggle in English. Remember, confidence is everything. If you're not comfortable with English and you've come this far, you need to rethink your goals and what you want to achieve. You might need to take more time to practice, and it's important to set a schedule and plan and follow it. Smile. No matter what, smile when you can. I know it might seem counterintuitive because medicine is a serious business, but smiling, not fake smiling or smiling all the time, but offering a smile when possible can make a big difference. It shows you're comfortable and friendly. There you have it. 7 tips plus a smile to get you ready for your residency or fellowship interviews. My name is Mark. On this channel, I offer communication tips as well as other information tips for international medical graduates who want to work in the United States and other English-speaking countries. If you like this video, please consider liking and subscribing. If you have any comments or suggestions, please leave them in the comments section below. Until the next video, have a great one.